Hi, come on in. I think I've met Frankie before. I think I came home to see him once.
Everyone's met him.
Yeah.
Everyone.
He's Mr. Popular.
So, he's been quite sleepy at home, sleeping quite a lot.
Okay.
He hasn't done any poo in the last couple of days.
Okay.
And we have oxygen for him at home.
Yeah.
He's been in hospital for the last 2-3 weeks. With his mum.
Frankie's suffering from a genetic disorder called Chromosome 3p deletion syndrome, which is a very rare genetic problem. Genes are the bits of code that make us who we are and tell our body how to grow and develop. And unfortunately, in Frankie's case, he's missing some of this code, which can lead to some problems in the way that the body functions.
Yeah.
And it's christening on Saturday, so we just want to make sure things are nice.
Yeah.
So we don't miss it.
Of course, yeah.
He's supposed to be having his open heart surgery next week.
Right, okay. Okay, so a lot of important things coming up.
Yeah, but I'm not sure if that's going to go ahead because Great Ormond Street said they haven't had the pre-op assessment. I think people haven't spoken properly and it's been sort of screwed up.
I guess it's quite a complicated case, isn't it? So there's lots of people who need to speak before this sort of thing happens. Okay.
Baby Frankie is having a heart operation because he has a hole connecting the left and right sides of his heart. He also has a narrowing of one of the arteries that leaves the heart, and so this needs to be surgically repaired.
That's all right, mate. I mean, I remember compared to what he was like when I last saw him at home a few months ago, he was really struggling with the breathing and it was really rapid. But the breathing seems a bit more settled compared to the last time I saw him.
That's good. That's what I want to hear.
Chromosome 3p deletion syndrome is rare in itself, but Frankie actually has a particular type of deletion called 3p25, which, if you look at the literature, only 50 cases have been reported since the first case was found in 1978. The most common problems include difficulties with breathing, which we saw that Frankie had, but also some structural problems with the way that the heart forms. There are also difficulties with feeding and gaining weight, and later on in life there can also be difficulties with learning and behavioural problems as well.
Like I mentioned, I mean, compared to the last time I saw Frankie, his breathing actually isn't that bad.
Yeah.
I think he does tend to sort of suck in a bit from what I recall of seeing him, and that seems to be his normal. But actually, at the moment, his temperature's down, and actually, in terms of his symptoms, I think actually he's doing all right.
That's good.
Obviously, if at any point he does develop a fever, or you're worried that his breathing is worsened, then obviously we can see him as an emergency. Or you can, ring 111 if it's out of hours. Okay.
The long-term prognosis, it will be a challenging course for Frankie, undoubtedly, but he's got specialist input and he'll have the right sort of care right the way through his development to ensure that he is able to live as fulfilling life as possible.
Thank you very much.
Yeah?
Good man. Does that sound good to you? Yeah?
Yeah.
Yeah, tell your mum. Ooh. Cheers, mate. Thank you.
All right, take care.
You too. Bye-bye.
Bye-bye. Has he been quite upset and miserable otherwise, or has he been coping with all this quite well?
Quite well.
Yeah?
He's happy.
Yeah, he's quite a happy baby.
Happy, yeah.
Okay.
The thing is, though, he might scream, like, he don't want the ball, and the next minute he's like, and you try and put the ball there, and you push it away.
I do think you're such a happy baby, aren't you?
Yes, you are.
OK, well, best of luck.
What's wrong? What's the matter? They're very beautiful now. They get harder work when they get older, don't they? Good luck. Bye. Come in, have a seat. Hello, I'm Dr. James. Morning, morning. Come and grab a seat. No, what can we do with Rhoda then?
She got burned. She burned her leg.
How did she burn her leg?
She pulled the kettle.
Oh, right, OK.
Yeah.
Where was the kettle?
The teapot, I mean.
Oh, the teapot. Oh, right. Was it on the sort of table or where was it?
Floor.
On the floor.
Yeah.
Oh, right. OK.
So I was concerned because of any infection.
Shall we have a look and see then?
Yeah. Sure.
Yeah. I'll let you take it off. What's this from? OK, so they are nasty burns, but they're not infected. And you've sort of done a good job because they are beginning to sort of seal over.
Yeah, because 2 days I opened it and
Yeah.
I left it under.
Yeah. If you've got some Gelinette, it's worth putting a little bit of some Gelinette on again. What we ought to do is just check them again in about 2 weeks to make sure it's all settled down. I think this looks like a little reaction to something. You can see there's some little.
Just now.
You could give her a little bit of Piriton solution, which is an antihistamine.
Antihistamine.
Yeah.
Okay, so.
I'll give you some of that. But I mean, obviously, teapots and stuff, you need to make sure that they're well away because at this age.
I just said to my husband that I'm gonna make another tea.
Yeah.
And I got up and she pulled it.
Yeah. Okay. Obviously, try and keep it out of your way because you're very inquisitive. Is she crawling and stuff at the minute?
Yeah.
What I'll do is I'll just get something just to cover that for you. Sorry, sweetheart. There you go. There we go. You're just put Gelinette on as you've been doing that. Okay. With this, it's just 2.5 mils, half a teaspoonful, up to sort of 3 times a day, just to try and help with that little rash that's obviously she's reacted to something. Okay.
Not at all. Take care then. Bye-bye. Bye.
Have a good day, you too. Bye-bye.
Anyway. You've been in the wars, have you? Literally. Right. So what happened?
I went inside this park. I was trying to jump over the fence when we were going out. So my foot got stuck in it.
Yep.
And I fell down on the hard floor. And I
Whacked your eye straight on like that. Yes.
Straight on. She got
dear. Okay.
this injury over here, and it was quite swollen at that time.
Yeah.
But
When did it happen?
On Sunday.
On Sunday. Okay.
Yeah. At the moment, it has gone all over her eye.
Yeah.
So
You can be hit over here, and you can still end up with a black eye. It's almost as if with all the tissue in the scalp and around the eyes, when it bleeds underneath the skin, which is what a bruise is, it's very vascular, so you get lots of bleeding, and it can track down through the tissue planes and will end up around here. So it's really common to get this, even though the hit was up here, often it will come down here. Now, what I need to do is just make sure there's no deformities of the bones. You're very brave. Okay, there's none of that. What I want you to do, okay, is look at my finger and just move your eyes to follow the finger. Can you do that for me? And what I want you to do is tell me if you get any double vision, okay? So head nice and still, ready, follow. Okay, only one finger?
Yeah.
Good. She's going to be fine. Okay. So there's no deformity of any of the orbit, okay? What we check for then is just in case sometimes you get a little crack inside the orbit and the muscles that control the eye can get stuck a bit, okay? So if that happens, then the eye doesn't move as well on one side, so you end up getting double vision.
All right.
I'm happy she's not.
Okay, so she doesn't have.
Yeah, so I'd keep an eye on it, just see how that goes. You would expect this to slowly get better over the next 7 to 10 days, okay? So it will change colour, it will turn into a sort of a deeper, then it'll go sort of a brownish colour, then it will fade away as the body absorbs that sort of blood back into it. But it may even look a little bit worse tomorrow. Right. Next time, don't jump over that fence. Okay?
Thank you very much.
Bye-bye.
Bye.
Come through. Hi, come and take a seat.
Thank you. I just have an appointment for checkup. I think I just get this one.
How old is Anthony?
How old he is? He is 5 now.
5 months old.
Yeah.
So why didn't you come for the 8-week check?
I don't know, because we was in Poland. Then.
Did you have it there?
No, darling. No. Injection.
Has he had any of his injections?
No, darling,
None.
No.
Okay,
no.
Agnes, it's very important. The system in this country, it's very, very important that the babies don't miss the immunisations, okay?
All right, okay?
So we don't like people to start travelling around when otherwise they miss all those things that they need happening.
Right.
So at 8 weeks, we had to check the hips, the heart and the eyes. Very important for us to do that, okay? The immune cells that mother gives to the baby by the placenta, they start to produce as the baby's getting older. And it's really, really important that we start those vaccinations from the age of 8 weeks. There are incidences where babies do slip through the net, unfortunately, especially in Slough, as we have a multi-diverse population. Travel is very common, and therefore appointments can get missed. Is his weight increasing? His weight, has it gone up?
Oh, he's grown up.
Yeah.
He's
Okay.
absolutely fine. My mother, he said he's looked like
Sure.
1 year.
Lovely.
Yes,
Does anyone smoke in the house?
Yes, we're smoking. No, in the house, never outside.
So you and Dad both smoke?
No, only I'm smoking.
Okay.
He's not smoking.
Okay. Have you been going to the health visitor?
No, I didn't.
To the clinics? No.
No.
Try to go to the health visitor clinics. They're really good. They'll give you advice about feeding, which food you should
Do
start.
I have to go? Oh.
It's better to go. Just
But
to go.
I have a second child.
I know, but we need to check the weights.
I don't think so. I will have time for that. But
Why is that? Are you working?
No, actually, Jacob is just going to school, and I'm just care about with.
No.
my
If you
husband's
ring
father.
them, they can come to your house.
Oh,
Okay.
okay,
We
fine.
need to start getting weights. We need to get weights done for him as
Okay,
well.
yeah,
Okay.
okay, fine.
Lovely.
Ira Hasnain, please. Hello. Right then, come and have a seat. So, Ira, you're getting a big girl now, aren't you? Yeah? Do you go to nursery or to preschool?
To school.
You go to school?
You go nursery school, don't you?
Yeah. Do you like that? Yeah. Is it lots of fun?
Yeah, we've got a fun day later on today. Fun day.
Oh, wow. So, because you're a big girl now and you're going to nursery, I've got to give you 2 little injections. And do you know why you have to have injections?
I'm brave.
Because you're brave, yes. And because if you get your injections now, then hopefully you won't get sick when you go to big school, will you? And you don't want to get sick when you go to big school because you'll miss out on everything.
All the fun.
Yeah. Okay, so just 2 little injections and then I might have I was brave for the nurse stickers. Yeah, so we'll have a look at those in a minute.
The lion one.
Your lions are very brave, aren't they? Right, you sit on Mummy's lap then.
So my lap then, Ira. So we have this done and then later on we go to the fun day at nursery.
Yeah. No. That's it, good girl. All right, okay, you look at Mummy. That's it. A little pinch. Good girl, little sting. Good girl, well done.
It's
well
okay.
done. Well done.
Oh,
Good girl.
that's okay.
Do you want a sticker? Do you want a sticker now?
Do you want and then which one did you want? Where's your lion?
Oh,
one?
lion. There he is. There.
There
Bravery
he is.
sticker.
Oh wow, you're so clever. Look, so clever and brave. There we go. One lion, and then maybe you might get another one.
Yeah. Yeah.
Good girl. Good girl. Wow, you're so clever. Well done.
Good girl. One more little pinch. Good girl. Little sting.
That's it.
All finished. All done.
All done. All done. All done.
All done. Oh, good
sorry,
girl. Well
darling.
done.
Wow. Well done, Ira. Let's go home and then we go to our fun day, yeah? Shall we go to our fun day? Did you want another sticker?
We've got a pink elephant.
So nice.
And we've got a koala bear. No. Are you happy with your lion or do you want one for later maybe?
I'm going to tell all the teachers.
Yeah? You can go and enjoy yourself now.
Yeah.
Yeah? No more injections.
You were so brave. All the children have to be brave, like you. Yeah, you can tell them you were so brave.
Yeah.
Yeah?
Nobody ever wants to speak to me after I've given them injections. All right then, take care. Bye-bye.
Thanks very much. Bye-bye.
Hello.
Go last, like.
So we just check the feet. Lovely. Just want to check his ears. Lovely. I'm just going to check his hips as well. That's lovely. You can get him ready now. Yeah, there's nothing abnormal. His eyes, heart, and hips all seem fine. There's no birthmarks, and there's nothing in the mouth like a tongue tie or anything like that. So that's all good. Pop back outside and see the nurse for his immunisations, okay, vaccinations.
Okay.
And then from now on, just record it in here and ask the reception for the health visitors' numbers.
Oh, okay.
So I'll come with you.
Okay, fine.
Yeah,
okay.
let's pop outside and we'll have a check now.
Please, thank you. Oh, sorry.
Come through. Oh,
Sorry, thank you.
come through.
So is he smiling?
He is.
Yes, not at the moment, of course.
And, but yeah, he is.
He does smile.
How are you? Yes, you're a very friendly chap. Yes, you are.
She's tiny, isn't she? Little dot. That's a good girl. Oh, she's taking it well.
Hi, young man. Tummy feels lovely, soft.
Enjoying that little massage there?
You don't normally get this on the NHS.
No.
That's a lovely smile there, young man.
What does that mean?
How can I help?
One concern is he's getting pale.
Okay.
And he's eating a lot of paper. Paper, tissue paper, books, newspaper.
As in he's putting it in his mouth?
No, eating and swallowing. Like, he just chew and take inside.
Right, okay.
And he's getting pale. And his eyes are getting, like, puffy from last 2 weeks. Before that, it was not like that.
Okay. And the swelling is just in the face?
Face, yes.
Okay.
Puffy eyes.
Okay. And so what sort of things were you hoping for? What sort of things do you think we could do?
Like, my sister is doctor as well. She's in Germany. So she said, you better consult with a doctor for the thyroid and the kidney tests.
Okay. So what I'll do today is just give him a general check over.
Yes,
all right.
I just want
and then we
to
can
just suggest him a blood test.
Yeah, and then we can do that.
I like that. Look, his whole body is very.
And that's
like,
not his normal colour.
Look.
Yeah.
You can see his feet's a bit yellow. Yes. Okay.
Oh, it's all right. I think one thing we can do is do a blood test to check if he's anemic, to check like the kidneys, as you mentioned. We can also include the thyroid blood test in that, and also the vitamin D. Okay. All right. I mean, the issue with the paper, I think it's likely that it's probably a phase that he's young and that kids put stuff in their mouth. Let's do the blood test. They normally take about a week to come back.
If there is something fishy, so they will call you.
Yes,
right,
so
same day.
I will keep an eye out for the results anyway myself, and we'll let you know and bring you in for the
I will
appointment.
keep in mind. So
All right.
definitely in the morning I will go there. Thank you,
All right.
Dr. Taylor. Thank you.
No problem. Take care.
Bye.
Are you Logan? This is Hussein, who's sitting in with me today. He's a student. So Logan tells me that he's just had ulcers on his side of his tongue since yesterday.
Yes.
Okay.
He's recently just moved up to the 8 mils of Tippletol.
Yeah.
So we were told to look out for things like that.
Yeah, absolutely. Yeah, good. We'll have a look. When did he move up the dose?
He's been on 8 milligrams since Tuesday.
Okay, right. Okay. How's he doing in himself on the Tailor?
Yeah, not bad.
Not bad, yeah. So Logan is a delightful chap. He has a form of epilepsy called temporal lobe epilepsy. Tegretol is a very useful medication for epilepsy, but can cause mouth ulcers.
Have you got your big R voice on?
His big what?
Ah.
Oh, very good. Excellent. You certainly have. You're ready. Is that where you're
Well, I only sort of feel it here.
but do you feel it out in your skin, or do you feel it in the inside of your mouth?
Only in the inside
On
of
the
my
inside.
mouth.
Oh, okay, so open your mouth wide. That's right. Really good. Stick your tongue out. That's right. Yeah. Is it that side that's sore? Yeah, very good. And say, oh, again. Fantastic.
Oh.
The number of children who, they'll open their mouths, etc., but they won't say that, oh, nice and loud. You know, you could hear that down Slough High Street.
No, you couldn't hear that.
No, that was just a joke. That's good. Just want to look at the inside of your mouth. Well done. Bring your tongue back in, Logan. Yeah, that's good. So just point to me where it's sore with your finger.
What, the jaw?
Yeah, just
The
yeah.
jaw. Where do
Oh, it's the jaw there, right? Okay, yeah. Good. Well done. So I think that, and this is just a viral ulcer,
Yeah.
and I think that it will go after a few days. It's
Okay.
not connected with his treatment. It's not that
Right.
kind.
Okay.
The kind of mouth and we call stomatitis, inflammation of the mouth, with this medication is very clear, is very distinct, causing mouth ulcers.
Yeah.
And sometimes it can be really severe, blisters around your lips and so on. And that's not what he has, but it's the right thing to do to come in. So this is just a virus in his mouth. I'm going to give him something as a mouthwash to
Right.
use and just swill it around, spit it out. Don't swallow it.
You know how to use a mouthwash, don't you?
Oh, yeah. Put it in mouth.
Swish it round. You don't
Yeah.
swallow it.
Mm-hmm.
That's it. Well done.
That's it.
It's just like bubble gum. You never ever swallow bubble gum.
That's right. Do you know what part of the body that is, Logan?
The spine.
Good. Well done.
I can tell by these bits here.
Yeah, that's right. They are, absolutely.
Those bumpy bits that you can
Those-
feel in your back are exactly these.
They are exactly those. That's really good. You know, there's an awful lot of grown-ups who don't know that.
Ah, I see.
So you're doing really well. Logan, nice to see you. Well done. And hopefully these ulcers will clear up. I'm sure they will with this mouthwash. All the best. Bye. Bye now.
Hi, come through. Yeah, good. Haven't seen you in a while.
I know. How's life?
Not bad. So you got a little one?
Yeah, one of two. She's a twin.
Okay.
She's had patches of eczema.
Yeah.
We got the Cetroben cream
Yeah.
for it, but it's
Yeah.
got really angry and really red.
When did it flare up, do you think?
A couple of days ago, actually.
Okay, we'll have a look. How's the other twin?
Yeah, he's fine. He doesn't have any.
Oh, has she scratched it?
I think, yeah, here, look. See that?
Yeah.
It's like severe.
If it was an adult, you'd almost start to think, is it a psoriasis thing?
Yeah.
But obviously at her age, you can't jump to that conclusion, and it's not very scaly on the surface. So I think it is a dermatitis eczema type thing. So we need to step up to a steroid cream.
She had it for ages.
She has had it, but not really red, has she?
Okay.
It's not really red lately, hasn't it?
That's very helpful.
Angry.
So normally the Cetroban helps to calm
Yeah,
it.
well, we just pop it on every now and again.
Is she sleeping at night?
Yeah. Oh, yeah, brilliant. That's the thing. She's not
Okay.
unwell or anything like that.
Fine. Have you noticed anything if she eats, if it aggravates it, or is it just
I've
sort of-
not, to be honest.
And any pets at home?
Just turtles. Well, we've had them since they've been born
Yeah.
and they're tanks now.
And they're quite hyperallergenic. So looking at her history, she's not had a steroid cream in the past. So I think given how it's sort of in many places, I think I would step up to something like Umivate ointment, which is just a step up from hydrocortisone. I would rather she have something a bit stronger, but use it for a shorter time. So hopefully in the next week, the redness will subside and you can carry on with
we use that
Cetroban.
with Cetroben as well.
Yeah.
or-
The other thing is if she is scratching and itchy, we could give her also an antihistamine type syrup. If you find it's making no difference with this, then we'll need to review it. Do you want me to give it to you?
Ta. Straight in the mouth.
I know. That's everything goes in the mouth.
Wait a minute, please.
All right. See you later.
Say bye-bye.
Hope that helps.
Bye-bye. Thank you very much.
All right. Take care. Okay. Bye-bye.
Where's my phone?
I did put it on top of Nanny's handbag, so it's probably on the kitchen side.
No, I put it off and put it on the charger.
Ashanik Richards, please.
Come on, let's go.
Come in. Hello, come in. Have a seat, please. Right, how can I help?
Right, I rang for advice the other day, and they told me to come back in because I need to get her referral pushed to urgent rather than...
Okay, let's see what it is.
'cause
Yeah.
it's just like normal, because it was about her fit. Well, it was like seizures I explained to the doctor, and she thinks it was like, could be a form of epilepsy.
Okay.
But I
Usually
actually-
we do it as urgent if
Yeah,
that's the case.
but when I rang up the other day, they said it wasn't. But what I actually did do was record it,
Should we have a
so
look?
that I've got proof of what it looks like. And to me, it looks like the start of a fit. Started happening last March.
Mm-hmm.
She took an overdose, and she ended up in hospital for a week. And the seizures started then.
Did they say it was related to the overdose?
No.
Okay. What did she take?
It was a concoction of like drugs. She was out with her friends.
Okay.
And it was a concoction of things. And she called them bang bangs, these little silver canisters. And it was that, yeah.
Okay. Right. Yeah, have you got the video?
Yes.
When was this?
This was Thursday.
So she was sleeping.
No, that's her, innit? Her eyes are rolling in her head. She's awake, but when she's like that, she's not responding to you. And her breathing's funny. Can you hear the breathing?
So she was awake at this time?
Yes, she was
What
awake,
was she
yeah.
doing before this happened? Because she's lying down at the moment.
Yeah, because when they come on, you can feel them coming. And we was downstairs, and she said, "Mum, can I come to bed with you?" So I said, "Right, yeah, okay." So I had to hold her hand because her legs started to go as well. So I held her hands, took her upstairs, and I put her in the bed, and then she laid her down, and it was a few minutes after then that it all started, and her whole body was shaking.
Mm-hmm.
But they weren't forceful convulsions. They were.
Okay. And when was this again?
Thursday.
And how frequent?
But before they weren't like this. So it's like they're changing and they're different. Because before it's almost like people talked to her when she was getting dead people talking to her, and she would cry.
Yeah.
But when they first come in, she smiles. She's got a silly grin on her face. So I always know when they're starting to come as well and she clicks her tongue. She hasn't actually had one since Thursday because they're not every day.
Yes.
Because before she went a good few months without having one, but then they come all of a sudden again.
So you want the referral? Usually that's what we do.
Yeah, apparently it's been referred, but it's not on as urgent. And she said it could take a long time, and I'm thinking, it could do more damage than good.
Usually they're very good. I mean, they usually triage their letters as well, and if the thing is urgent, with pediatrics, they're very good.
Because I still haven't heard anything.
No, don't worry. I will make it as I will ask the admin team to change it to urgent. So we'll resend it as urgent. So hopefully you'll receive an appointment. But if you're not getting an appointment early, just let us know.
Okay, great. Yeah, because they were telling me 6 to 12 weeks, and I was thinking, oh gosh, that's a long time.
I wouldn't worry. You should hear within the next 1 week at least. Okay, anything on video would be really helpful for the pediatricians to see as well.
Great.
Okay?
Thank you very much.
You're welcome. Take care. Bye-bye.
Bye.
So this blocked ear, how long you had it?
Was it a week, 2 weeks? Yeah.
A week, do you think?
Yeah.
Yeah, you had it done. I'm just trying to think. It must have been a couple of years ago.
I can't remember ever having it, Ron. Funny that. I'm usually good at remembering that. Obviously, I'm not. I don't remember having me hit done.
Good, come right in. You've got everybody with you today?
My whole family.
How are you? So this is Azan. Hello, Azan. How are you? I'm Dr. O'Donnell. How can I help?
He went for a tonsils operation in the end of May. Grommets put in his ears, and he had his nose.
Adenoids, yeah.
In his nose.
Yeah.
Ever since then, it was 2 weeks, and he's been sick. His keeps vomiting. Now he's come up with a really bad rash all over his hand. He's swollen on his face.
Is he vomiting once every day or once every few days?
Once really every day, but for the last couple of days, because he's not eating and he's drinking a little here and there. And when I'm trying to feed him, it's just coming out.
Tonsils and adenoids are part of your defense mechanism. So when they're taken away, it does leave you without that protection. The main controversy is, are we removing tonsils and adenoids from children who don't really need that surgery? Are we exposing those children to risk and to harm without any real benefit? Just sit forward. That's right. Good. Just going to take your temperature. That's fine. We'll work out what to do. It's 37.2, so his temperature's okay. Yeah. And when did that rash come?
Do you know, this came this morning, I saw it.
Okay.
It was on his face as well.
Yeah. Just stick out your tongue for me. That's good. Just stand up and we'll have it. Yeah, that's fine. We'll just look in your ears. Yes, you can close your mouth for the moment. That's right. That's good. So grommet is in there. So just open your mouth like a big shark. That's really good. Well done. Now he's going to look at your nose. Good. And just sniff up for me. He is still quite congested. Any cough at all? Open them.
Yeah, the cough.
Big eyes. Big eyes. That's right.
Every night. Cough,
really?
cough.
Yeah. Okay, so what I think's happening, I think he may be brewing a bacterial infection called scarlet fever. Scarlet fever is a bacterial infection, and it causes a high fever and a red rash, sandpapery skin, and an unusual tongue, which is coated white, and looks a bit like a strawberry. I think it might look a bit like a strawberry in frost, perhaps. One of the interesting features about scarlet fever is that it is the toxin released by the Streptococcus bacterium in the throat getting into the bloodstream and causing the red rash. And the red rash gives it its name. But also, I think he may have a localized infection in the operation site that is blocking his nose, which you wouldn't expect.
No.
So what I want to do is I want to give him nose drops, and I want to give him an antibiotic called clarithromycin.
Okay.
And I want him to take that for a week, twice a day, morning and night. But I wouldn't be otherwise worried about him.
All right.
Yeah. There you go. So hopefully this will make you feel a good deal better, Azan.
Yeah, it's lovely.
There you
Thank
go.
you very much. Thank you. So
Well
bye,
done.
so thank you.
Hopefully
Thanks
he'll
very
get
much.
us soon, yeah.
Okay.
Bye, Mum.
Bye. Take care. Thank you.
Thank you.
Thank you. Bye.
Hello there.
Hiya.
Come in. Sorry to
Sit
keep
down,
you.
Charles. That's all right. Sit down.
Hello, Charlie. He's had some pain.
Yeah, lower abdomen,
Okay.
right in the middle. Now, he's had this a couple of times over the last month or so, but it's not been to the extent that it was this morning. It's coming again. He said the pain is always there, but it like spikes.
Yeah.
And then he's doubled over and it's like cramping and stabbing.
Yeah, okay. And when you do a wee, does it hurt you when you go to a wee, Charlie? When you do a wee?
No.
Doesn't sting. Good.
He goes for a wee a hell of a lot. Like, he'll go in the space of an hour about 5 times. I'm like, why do you go to the wee so much?
Sometimes boys, their bladders are slightly sort of weaker than women's, and you find that they tend to sort of go and they sort of get out of that. Now, if he's not getting any pain, it's unlikely to be an infection, but I think it's worth trying to get a urine sample at some point and bringing it so that we can test that. You haven't had any diarrhea when you've been to number 2?
I have had one.
That was a couple of weeks back.
Oh, a couple of weeks ago.
1 week ago.
1 week ago.
1 week ago?
No, I
Okay.
think it was a couple of...
I had to have toast.
It hasn't been constipated. It's not been like when you've gone lots of little hard things and difficult to get out.
No.
No. Can I have a look at you and your tummy up on the table? Shall we jump up? Let me get this for you. Good man.
That's a good
Lie down. Good. That's good. Just open wide for me.
It was really warm this morning, actually. I've given him some Nurofen.
Relax. Just check his temperature and open that up. Okay, that's fine. And then that way. 36.4, so that's okay. Let's have a little feel of this tummy. A wee bit sore down here. Sorry. Have you had lots of wind? You're a bit windy, aren't you?
Yeah.
Yeah. Come and sit up again now. He's obviously getting some crampy pain and the bowels are quite active.
Okay.
So it sounds a little bit more like he may be getting a little bit of a bowel infection and he may end up in a bit sick or get some diarrhea again with it. Sometimes very early things like appendicitis can present just with general tummy pain. And at the minute, there's no indication that that's what it is.
Good.
I would continue doing what you're doing, give him some Nurofen, a little bit of whatever he fancies to eat, and a little bit of fluid every so often.
But tell him that'll be asking me for ice cream for lunch.
Yeah, whatever, in a sense, whatever he'll take. If he's getting worse or going downhill, bring him back this afternoon so we can just do a double check and make sure it's not anything like appendicitis or anything. But if you can get a urine sample, it's worth just, if you do, dropping it in so we can just check.
Got a pot or anything?
Yeah.
Thank you.
What am I going to have to do?
Oh, lovely.
Okay, young man.
Say thank you to the doctor.
Thank you very much. Pleasure to meet you.
Okay.
Okay.
Brilliant. Thank you so much.
Okay, not at all.
Cheers.
Well done, well
Some of
done.
them were at once. Right, look.
Come through. How are you? Appointments for him?
Yes, not bad.
Good. All right, so how can I help?
He was sweating a lot in bed.
Yeah.
And the mornings, his pajamas was basically soaking wet.
Yeah.
And he had a bit of a cold on him and cough on him.
Yeah, I always have coughs now. And my mummy has bleed.
That's right.
Yeah. How long has all this been going on for?
Sweating been over 2 weeks. Coughing is
You
bad.
can take
Been
your
a
jacket
month.
off. It's not raining.
Okay, Dorian, darling.
All right, let's have a look at him, and then we'll talk about the X-ray, and then we'll decide what we're going to do. Dorian, let's have a look at you, darling. All right.
What's that?
What is this?
Yeah.
It's a torch.
For all your ears.
Yeah, your ears and your throat. So say ah for me. Big ah, show me your tongue. I can't hear you. Say ah. Good boy. Oh, is he bringing anything up with the cough?
Yeah.
Okay.
You see any water in that today or not?
Do I see any water? No. Can I see anything growing?
But when I drink
No.
water, it makes the sound in, but the water goes in my ear, but it goes all the way down.
Does it?
Yeah.
So when you drink water, it goes in your ears?
Yeah, fan, it goes all the way down
Wow.
to my mouth.
Wow, that doesn't sound right. Okay, can we have a listen to your chest here?
Yeah.
Okay, good boy. Some deep breaths. Okay. And
About
turn around
like
here
that?
for me. Oh, yeah, I'm coming onto it. I'm coming onto it. Come on. All right, and again. Keep your mouth open, darling. Okay. All right. What the chest X-ray shows is that actually just in some of his airways, they just look a bit thicker, and that can sometimes happen when you've got build-up of mucus in the lungs and the airways. So it may be that he's just harbouring an infection, but because it's gone on for so long and he's been having the night sweats, he's probably best treating him with some antibiotics to see if it settles it down and clears up the congestion that's inside. So are you okay for him to have some antibiotics?
Yeah.
Yeah. Is he allergic to anything?
No.
This is your medicine, Dorian.
I hope it's going to be okay.
Yeah, let's see. If afterwards things aren't settling down, then come back and see us. Okay.
Sticky things on my shoe, look.
Yeah, you do. Oh.
Yeah.
Okay. So you've stepped in something mucky.
Another one, let me check. Nope.
Can
Only a little bit.
Mum have to clean your shoes?
Here.
Yeah, thanks, Abby.
All right,
Yes. So thank you to the doctor.
Thank you.
You're welcome, Dorian.
Good boy.
Do you know, after my lunch, I'm going to go to the police station.
You're going to the police station? What? Have you been a naughty boy?
No, but just playing with the police station mans and ladies.
Oh, okay. All right, you make sure you have fun then, okay?
Yeah.
All right, bye-bye.
Hello there. Come in, come in. This is Casper. Grab a seat, Casper. Do you want to sit there? Right. What can we do for Casper? Is this a bit of a giveaway?
My hand hurts.
Uh-huh.
Basically, the ball hit here, then it's starting to hurt here.
Right, okay.
It hurts.
It hurts there.
pain or?
Yeah, it's pain. Okay, you can see that's sort of swollen, can you?
Yeah.
And also, it's a little bit sort of bent here. Now, children, is that sore there? If I do that? Children's bones are very bendy. He may just have bent it, or he may have a little crack in it, but I think, given that how swollen it is, and that it's still sort of quite sore, I think we need to get it x-rayed.
Yeah.
So what I'm going to do is I will put the form for the X-ray on the system. You can take him up to X-ray today, anytime now.
Okay.
They will X-ray it, and then if there's a problem with it, they will normally say we need to put something on it, and they'll send you to A&E straight away then. But it's quicker to do that than just say go up to A&E.
Okay.
Does that sound sensible?
Yeah.
Okay.
Okay.
But I think he might have a little break in it or a crack. Or certainly he looks as if he might have bent it.
I'm scared. Why?
No, you don't need to be scared.
There's nothing wrong. I should be scared, not you. I'm scared of you. Something's going to happen to you. Makes sense? No. No, it doesn't. And I know it does. Don't worry. Doesn't.
So if you go up to the X-ray department, go up anytime now, the form is on their system.
So, Mummy, now we're going after this?
now we go.
Yeah. In the meantime, just get him up there, get it done. If it's still sore and there's nothing extra broken, paracetamol is probably a good thing to help with this.
Okay.
Okay. Right, young man?
Thank you very much.
You're very welcome.
Okay, thank you.
Okay, you're very welcome. Take care. Bye-bye.
Have a nice good day.
And thank you very much. Bye. Bye, Casper.
Bye. Bye.
Hi, how are you?
Okay, I don't know if you had the A&E report. She fell back onto the floor
Yeah.
while she was playing with her dad off the sofa. I can't even remember how long she was actually not breathing for. She went blue, rigid, and fell. And then a couple of weeks later, she did it again.
Okay, so what?
But it wasn't as bad.
What happens?
You know when you're crying but you don't take a breath?
Yeah.
She just didn't breathe. She went blue.
How long did that last for?
It felt like it was forever, but I think it was probably 5 minutes, the whole process. When she did come around again, she was slurring, she was still woozy. But once she made it to A&E, within like half an hour of being in A&E, she was back to normal again.
Right. And that was that one episode?
That was that one episode. Then it
Yeah.
happened a couple of weeks after.
Mm.
She went from her room to her brother's room,
Yeah.
slipped on the floor, and her brother went off on me, and I was like, what's wrong? What happened? Safa's not breathing.
Wait, did you see that long breath pause or anything? Or was it
No,
just
but her brother saw it.
Okay.
I know he's only 4,
Okay.
but he's quite aware, because he was there when it happened the first time.
Okay. Did she actually go blue the first time?
She went blue, lips, face, everything was just blue. It was horrible.
No, it sounds like this could have been what we call a breath-holding attack. Okay, so sometimes what happens is kiddies can hold their breath, go blue, and it can be very, very dramatic and obviously quite distressing for the parents. There are 2 types of breath-holding attacks, and they're divided into blue or white. Blue breath-holding attacks are far more common and essentially occur when the child is in pain or frustrated or angry. The lips may go blue and they lose consciousness. With white breath-holding attacks, they're also known as reflex anoxic seizures. It usually occurs after a sudden fright or a sudden onset of pain, for example, a minor head injury. They will go pale, limp, and there will be loss of consciousness. Occasionally, they also look like they're having a seizure where their limbs will go very firm and there can be some shaking movements. What I'm going to do, I'm going to examine her, of course, now. What I'm going to do is I'm going to put you into my colleague who's essentially got a specialist interest in paediatrics. I'm going to get her to review and make sure that she's happy with the history as well. Does that make sense?
That's fine. I just want to check there's nothing long-term.
Absolutely, absolutely. No, of course. Pop her on your lap for me.
Go on then. I'm going to go and sit on my lap.
Okay. And lift it up right up for me. Let's have a listen to her chest. Spin her around for me. Good, okay. So since the 3rd, she's been back to her normal self, running around, playing active, no concerns?
Yeah.
Good, okay. Breath-holding attacks are not a sign of anything more sinister. However, occasionally they can be confused with epilepsy, which is why it's important to seek immediate medical attention if something like this occurs. If, of course, an episode recurs, you've done absolutely the right thing. I'm sure in A&E they showed you the basic things that you should do. So if it does recur, make sure you seek immediate medical attention. All right? Lovely. No trouble. All right, bye-bye now.
Hello, Fires. You've got 2 spoons, and they're different sizes. So how is Fires?
Oh, he's really, the poorly feeling.
Oh, since when?
Nah, from day before yesterday.
Well, how did it start?
The sneezing and a sore throat.
Okay.
Yeah, coughing.
Thank you. Thank you for... Oh! Ooh. Hey. So he started sneezing, coughing?
Coughing, yes.
Now, if we take him out of that and we can examine his ear.
They really like it.
I know.
Coming out.
He prefers to be there. That's good. Sorry, I know. Right around the other side. I know, sorry about this. I know. Yes, okay. Nobody smokes. He doesn't live with anybody who smokes.
I am a husband.
Does he? Okay. You need to get him to stop smoking.
Sorry?
You need to get him to stop smoking. Smoking makes children get 3 times more infections in their ears, nose, throat, and chest. Even if your husband always smokes outside the house. Smokes inside the house, it's worse. But smoking just exacerbates infections and can make the child more likely to get infections. It's a common misconception amongst parents that they think if they don't smoke in the house, that the child won't suffer. That's just wrong, wrong, wrong. The products of smoking are on the clothes and on the breath of the smoker. And children are a lot more vulnerable to the effects of passive smoking. The effects are extremely serious. Asthma is much more common. Ear, nose, and throat infections. You're more likely to develop conditions like bronchiolitis or pneumonia. And cot death is about 30% more likely in the first year. He's got quite a sore throat, quite a big red, swollen sore throat, and that's why he's not wanting to eat or drink much. In his airways, he has some secretions, but the lungs themselves are fine. So this is really just about his throat. I'm going to give him some medication for a week. I think that will see it off. Now, we have a stop smoking service for Dad, so if you can try and influence him, and they can get real help and also help with medication or nicotine replacement to help him stop. So it's really worthwhile. I know, he has to want to, yeah. That's what you've got to persuade him, yeah. So 5 mils twice a day for a week. He's going to be like this for the next 3 days. Yeah, good. You're very welcome. Yeah, not at all. You're welcome. And hopefully Fives will settle down. So I think he will.
Come in. Come and take a seat. Your mum, yeah?
Yes.
Okay, and this is Amrit. Yes. How can I help?
Now, Amrit started off by having like a few little pimples on the side of his head.
Oh, yeah.
But it's actually then it got septic and the burst and then become blotches.
Okay. So when did this start?
In about a week.
Okay, so did it start with one pimple or?
Yes. It started with this one.
Okay.
And then, can you see how it spread? And there's some hair. Now it's getting really it started scabby.
Okay.
And it started there. It sort of gets a bit sore in the evening and on this side.
Yeah.
So where
Are
it's
they
like,
itchy?
Yeah.
They're itching.
And I can see
And
actually
they're
it's
yellow
going
too.
on. It's
Is there
going.
yellow pus coming out?
Yeah.
Like, is it clear or yellow, Mum? Have you?
And it's coming on this side as well, if you can have it.
Yeah, I'll pop a pair of gloves and we'll have a feel now.
It's itching.
Yeah, it's itching. Has anyone else in the house got a rash at the moment? And do we know what caused this? Did you remember being bitten by an insect? Anything at all? Okay.
She thought it was eczema, and she showed me eczema thing like it could go all over your body.
I mean, if we left it, it potentially could go to bigger parts of your scalp. So
we need to, and I googled it. So
Yeah.
I was saying to him, we must cut out your sugar. But he does eat a lot of chocolate.
Do you? So do you have a lot of sugar? On average, kids in the UK are consuming 3 times more sugar than they should be doing. Sugar can cause dangerous unseen fat deposits in children's bodies, especially around the vital organs. And this can start at a very young age. So we do encourage parents to cut back on a children's sugar intake.
I love sugar.
So I said to him, you need to stop that.
Yeah, I'm addicted to sugar as well. I've seen a rash similar to this actually.
Okay.
It tends to be bacterial. So the normal bacteria in our skin is called Staph aureus, and that produces that clear yellow kind of pus. So have a look at this.
It's like a number of allergies and things that are going within. But can you see where it's like now spreading?
Yes. Normally, we would give a topical or an oral, basically antibiotic. I think because this is actually spreading, we're going to have to go for the oral antibiotic or flucloxacillin. Is he allergic to anything at all? Penicillin, anything?
No,
He's had amoxicillin.
Yeah, he's had that.
With the creams and things, try to leave it dry. But if it's itching, obviously don't try to put any oils or things on it. So what are these toys you've got?
These are from the Kinder eggs, but I don't eat them anymore.
Because they've got a lot of sugar.
I've got only these 3. They're from the cartoons.
Really? That's the antibiotic. 1 spoon 4 times a day.
Okay, lovely, thank you.
All right then, nice to meet you. Take care. Oh, don't forget your green one.
Come on, you. Such a cheeky. Oh, God, you're such a rascal.
Avneet, cool? Hi, come in. Right, so what we're going to do today is we're going to start the vaccinations, OK? So today there's 3 injections and 1 medicine in the mouth. OK. So the one in the mouth is to protect the lining of the gut. OK, so because a lot of babies get diarrhoea and vomiting, they end up in hospital really dehydrated. A side effect, which I've never seen, but I'll just tell you about, is a problem with the guts, strangely enough, OK? The other 3 injections we're going to give in her legs. One of them is the meningitis B, and the research shows that it's quite likely she might develop a temperature with that one. Buy yourself some paracetamol, the brand name's Calpol, and that should be enough just to settle her temperature. So I'm going to draw up the vaccines, yeah? Oh, bless her. Are you feeding her yourself? Oh, wonderful. So that's what she's waiting for, isn't it? Oh.
If I hold her, she's going to cry.
Of course she will. Of course she will.
You're scared of
I'm
them.
more scared of it than she.
Oh, bless you. I know, it's not milk, is it?
Okay. I heard you.
Right, hold still. All done. You all right? Yeah. Oh, do you want paper towel as well? There we go. Oh, you're still going? Oh, bless you.
She's all right.
OK, so make an appointment on the way out for 4 weeks' time, baby clinic. That's all right. You can stop crying now. We're finished. That's all right. See you again. Bye-bye.
Thank you. Moving on.
All right, thank you.
Just need to put my baby's 4th week injection.
You just came in with that cute little baby. I hope you feel really horrible making her have an injection. Did she cry?
Loads. Yeah, even the mother cried.
Do you know what? I never used to take mine. I used to make my husband take them.
Yeah.
And do you know what? He found the best way to get the heat out of it? Get one of the small cans, put it in the fridge, and when it's had it done, just rub it on it. Just takes the heat out.
Okay. Thank you.
Ida, come through and have a seat.
Thanks.
Are you Mum?
Yes, I am.
How can I help you today, Cohen? I know you've had some back pain, haven't you?
Yeah.
When did it all start?
The school phoned me to say that he had this severe pain in his back.
Okay.
And if I could drop some paracetamol down, but it just got too bad for him. He was crying in pain, and then he still got it. It's just kind of come out of nowhere.
Yeah.
It's just that he's cried with it, and that's not like him.
Yeah, yeah. So how did it start when you were at school? What were you doing at the time?
I now got on a coach. And that's when it started, but I don't know how.
Was that the school bus? Yeah. Okay. So in the morning. Yeah, and then was the pain bad at that point, or did it get worse later?
It got worse later on, and it just stayed like that.
Okay, and whereabouts in your back does it hurt?
It's around here.
The middle bit of your back?
Yeah, and then lower down up to like there.
All right. Any problems going to the toilet to wee or poo?
No.
Is that normal? Yeah. Okay, and any numbness or weakness or tingling, like a strange sensation in your legs at all?
My legs feel a little bit dead.
Which one?
Both of them, but they're just down here.
Okay, all right.
It's
And
a little
any...
bit hard to walk, but
Is it because you've got pain walking, or it feels numb when you're walking?
I don't really know. It just feels weird when I walk.
Now, would it be all right to examine your back? Yeah? Okay, your mum can sit on there and then you'll be with him as well.
You sure? Yeah. Okay.
Back pain can be a symptom of something quite serious in children. Most commonly, it's because of a muscular problem or a bone or joint problem in the spine, but more worryingly, it could be related to infection or even something as serious as a tumour. So I'm going to just test a few things with your arms and legs. Are you OK sitting for now? Yeah. Can you put your arms up like this? Stop me from pushing you down. OK, stop me from pushing them up. Put your arms like this. Push me away. Pull me towards you. That's fine. OK. Is it OK if I just get you to take your trousers off?
No.
Again.
Take your trainers off. She's going to need to... She might feel your feet as well.
Yes,
I'll get you
I
to
will,
push
yeah.
your feet, so you need to take it all off. OK, he's ready.
OK, so if you can lie down for me on the bed, I'm going to just touch your legs to start with. Can you feel me touching you?
Yeah,
Is it about the same on both sides or different?
it's the same.
Now if I can get you to just sit with your legs hanging over the end. I'm just going to test the reflexes in your knees. If your child is experiencing back pain, the serious signs and symptoms to look out for are numbness, weakness and tingling of the arms or legs, and any bowel or bladder problems, so if they've lost sensation when they're going to the toilet.
Does there seem to be anything?
So from examining him, everything looks to be OK.
Yeah.
It's a bit unusual to have the pain and the numbness, though.
Yeah.
So I think for now, because the examination's normal, seeing how he goes over the next week or so with painkillers would be reasonable.
Yeah, OK.
And then I'll book him back in to see me and then re-examine again and see if things have got better.
Yeah, that's fine, no problem. OK, thank you. OK. Right.
OK, so did you hear what I was saying to your mum? Things seem to be fine from examining you, but I'd like to speak to your mum next week just to see how you're getting on. Yeah, and if you know better, I'll get you back in and we'll take another look at you.
Good.
OK.
OK then.
All right,
Thanks very
take care
much.
then.
Thank you.
Bye-bye.
Bye-bye.
Nice to see you all.
And you?
I'm Dr. Tawana. How can I help today?
I've spoken to you a couple of times on the
Okay.
telephone about Annabelle's condition.
Okay.
She's broken her arm
Oh,
3
okay.
times.
Yes. Tell me
About
what's been
her,
happening.
well, the physio that she had after her last break said
Mm.
she had hypermobility.
Okay.
We thought that had gone on the records, but
Yes.
it obviously hasn't. So
Okay.
we thought we'd make an appointment, come and
Yes.
see you,
Yeah.
to get her checked over and to confirm that's definitely
indeed
what
the
she's
case.
got.
Well, what we would need to do, has she ever seen a children's specialist?
No.
No. That's what we would
Oliver,
be
no,
considering doing, just because a diagnosis of hypermobility tends to come from our specialist.
Yeah.
Hypermobility syndrome is a condition where you can see a bit more flexibility of joints. In addition to the increased flexibility, other signs and symptoms may include pain of their muscles and joints, tiredness, although there are some less common symptoms which can include things such as bruising easily, headaches, abdominal symptoms as well. Can I just check, with these fractures that you unfortunately had, were they pretty much innocuous kind of injuries, or actually was some force that these fractures occurred with?
The first one she had was just falling over a bouncing toy we had, and she just fell on the floor.
And then
And
broke the bone there?
That was the worst one. She
Yeah.
had the op for that one.
It's okay.
And pins.
Yeah.
And the second one, she fell from a climbing frame, which gave her a green stick fracture on
Yes.
this arm, I believe.
Yes.
And then
And he went up the slide there and fell.
she fell off the slide and did this one again.
Right. I think what we need to do, quite simply, is get you seen the amount of fractures that you've sustained. I think it's a reasonable diagnosis, but I think just for formality, to get it properly confirmed.
Yeah.
The vast majority of patients that are affected will actually get better and will grow out of their symptoms and improve over time. So leave that with me.
Brilliant.
I will send that referral off in the next day or so, and they will contact you directly with a letter, I suspect, at the home address, and we'll go from there.
Brilliant.
Do you want to see?
Yeah.
Pop this in your ears. Here you go. And then what you do is I'll get you to hold it just there, around about there.
Good one.
Does it sound good? Lovely.
Thanks,
Okay.
Doctor.
Take care, guys.
Come on then.
Bye.
Bye.
Hello, how are you, Mum? Nice to see you. This is Hafsa.
Hafsa, yeah.
Hello, Hafsa. And who's this? Older sister?
Khadija, yeah.
Hello, how are you? Just take a seat. So how can I help you today?
She's been sick for a week now. She had a fever, especially last 3 days. She was fine like this, but she's gonna cry like she has some pain in the stomach or something.
All right, okay.
So, yeah.
Just now and again?
Now and again.
Now and again, okay. Right, good. She seems to be pretty full of life. Do you want to get onto my computer? Maybe you've got some medical talent here that we should know about. So just hold her head. Good to take your temperature, darling. Yeah, we are. Well, she's done quite well. So I just want you to hold her. Yeah, just one arm round her arms and one arm round her head. That's right. So let's just look into your ear and see what we can see. No kicking, Hafsa, please. Now, right round the other side. No, don't kick the doctor. You can kick your members of your family, but not me. That's right. Because we're just looking in and seeing what your ear is like. That's very good. You're a very friendly girl, Hafsa, I'd have to say. Now we listen to your heart. Just to see how fast it is. Oh, yes. Good. That's fine. She has, as you can hear when she breathes in, she's making a noise like...
Yeah, she does that.
And so that's because she got an infection in her airways. This is a fairly mild infection, but it's going to give her a temperature. It's going to give her some abdominal pain and probably pain in her throat and in her trachea because it's inflamed. Not badly. Give her Calpol when she's in pain. I think she'll settle down fine. I think I wouldn't be worried about her. Yeah, yeah.
That's fine. But
Good.
Thank you.
Bye-bye. I'm going to shake hands. Bye-bye.
Bye-bye.
Bye-bye. Nice to see you. Yeah. Nice to see you.
Come on, Marcus.
Come right in. Yeah. We have Catherine here, who's a student from Southampton. Hello.
Nice to meet you.
How are you? Okay, right. So, Marcus, what can I do for Marcus?
So he's been in hospital.
Yeah.
But for cellulitis.
Yeah.
But he's been self-harming very badly this week, and I'm not sure. They've told me to come back to the doctor.
Yeah.
To be referred to something, but he's just...
Has he ever been to CAMS?
Yeah, he's on medication.
Yeah.
He's just so angry.
Is that right? Okay. So what other medication is he on in terms of... Is he on anything from the ADHD point of view?
He's on Strattera.
Okay.
And he has melatonin at night.
Yeah, very good.
But this week, he's got a massive barbecue fork and he's been trying to stab himself and pull.
Has he done any damage at all?
I'm not too sure. Like, there's a couple of marks that have come
Just
up.
sit forward, Marcus, will we have a look? Yeah, just nearer me than that.
You need to sit like that with your head up, maybe. I think there's a little mark around there, but I got them off of him.
Yeah. Marcus, from the age of 2, had problems with attention span, problems with behaviour, and language as well. And it was eventually decided when he was old enough that he met the criteria for ADHD, attention deficit and hyperactivity disorder. ADHD manifests itself in 2 or 3 ways. So it can focus on hyperactivity, unproductive activity, disruptive activity, with sometimes a lack of focus, particularly on learning. How are you feeling, Marcus?
No, not good.
Really? Not good in what way?
You need to tell the doctor.
What's school like? The school's lying about me.
Saying what?
Like, they say my mum was gonna batter me, but that was a lie. I never said that.
They said that she was going to do it, or they said you were saying she was going to do it?
He went into school last week and said I battered him. So obviously
I see.
They checked him all over.
Yeah.
But because he's lied about me, I took his iPad off of him and his Xbox.
Yeah.
I never lied.
So then we get this, the school's lying.
Yeah.
It's getting
difficult,
very severe at home with the self-harming.
Frustration is very common with ADHD. Self-harm is prevalent, but it doesn't affect everybody with ADHD. It's a very difficult condition, and very difficult for Marcus to deal with.
Absolutely.
And very difficult for you to try and do your best as mum. It's difficult all round. But I think the amount of support is the key, I think. The amount of support, advice, and options and opportunities to give him worthwhile distraction so that he's doing something he likes and that actually gives him enjoyment. In managing ADHD, you're trying all the time to minimize disruption. And one of the first ways of treating and managing ADHD is to improve the library of techniques. So the focus is very much around family therapy and parenting therapy. And one of the most useful techniques is getting the child to focus on something that they're interested in and that they're good at. And if they can find that one thing, then that's the way towards salvation, I think. What made you take up golf?
I don't give up.
Good. And do you like it? Do you? Would you like to be a professional golfer when you grow up?
Yeah, I just want to be this guy. He's called Happy Gilmore.
Yeah.
Yeah, he can just batter it over about 5,000 metres.
That's a long way.
Very far.
4 miles. So how many times a week do you play golf?
2, no 1.
Once a week, usually, isn't it?
That's terrific. I'm really impressed. That's very good.
You've got to go to school.
No, I'm not.
So I'll ring them up. But have you got you've got all their numbers, haven't you?
Yeah, I've rang the crisis team and everything. They've not got back.
But have you rung this number in Upton, the 635645 number? Yeah. And what did they say to you?
They said they'd get a doctor to ring me back, but I've not heard anything.
Okay, I'll get on to them.
Yeah, that was
today.
last week I rang them.
Yeah, I'll get on to them today.
I'm not going to a dumb school.
Marcus, you have to go to school now.
I'm not going to school!
Stop it.
Why do you not want to go to school, Marcus?
The dumb liars.
Right, well, maybe...
Well,
Still not. Starting to say it again.
Okay, well, maybe we'll just have a meeting with them and see what we can do, some work from home.
No, they're gonna lie like they do.
Why don't I just get some work and we do it at home together? Yeah? Yeah? Is that better for today? Yeah? We'll do that then.
Mum, why do you believe in adults and not me?
it's very difficult.
Very.
Very difficult. I know it must seem so
Why do you
unfair.
not believe me? I tell the truth.
I do believe you, darling. All right then, what
Good,
do you
I'll
say?
get on to them. Yeah, it's nice to see you. Yes, just keep up with the golf, okay? Don't worry too much about school. Don't worry about anything else that upsets you. Just worry about the things that you can do really well in.
Yeah?
Okay? That's the key to being happy in life.
Okay.
Stay with what you're good at, and just get better and better and better at it.
Thank you very much.
Yeah,
Lovely
nice
to see you.
Yeah. All the best.
And to you. Thank you.
Bye.
Bye. Nice to meet you. Come on then.
Cheeky boy. Hello, what are you doing? You're not going to smile at the doctor today, no? Cheeky boy, aren't you? And who's this? What's your name? Your big sister. Brother, sorry. That's the hair, isn't it? It's your long hair, it's lovely.
It's okay.
Right, hold still.
No.
It's all right. You're a brave boy. Look at his face. He's having us on, aren't you? Cheeky boy. Good boy. Cheeky. Come on. Cheeky bum. Oh, you've been sick.
Darren Davis, please. Hello. You're 3 now, are you? Oh, you're getting a big boy. Right. Hello, you've got 2 of us today.
How are you?
He's 3.
3.
So my name's Julie, and this is Andrea.
That's my mummy.
That's your mummy, yeah. So because you're a big boy now and you're going to nursery and soon you'll have to go to school, won't you? To big school?
Yeah.
Yeah. So because of that, we have to give you some little injections. Yeah? So one little injection goes here and one little injection goes there. Okay? It's just a little ouch. Yeah? Very quick. And then we'll get you some stickers. Yeah?
Yeah.
Yeah, you like stickers?
Yeah.
So you're going to sit with Mummy and be a brave boy? Just leave that there for now.
Superman.
Wow, Superman! You got muscles like Superman? Whoa, big muscles! Mummy's going to give you a nice big cuddle. Okay, so you're just going to feel a little ouch. Okay, nice and still for me, darling. Oh, sorry. Little ouch.
Ouch.
Good boy. I know, sorry. That's it, that's it. That's it. That's it. Good boy, well done. Right, one more little ouch. That's it, good boy. All done. That's it, finished. No more. All finished now. Good boy, well done. That's it, all finished out. So you can give him some paracetamol, some Calpol when you get home.
We can't take that off yet, Darren. We have to
If you want to take it off, do you want to take it off? That's it. You want to do it, shall I? That's it, that's it. There we go. And this one. That's it. I'm sorry, you didn't like that, did you? There we go, that's it. It's all fine now. You're all done now. You don't need any more. You're all finished.
Now? Do you want your sticker now? Where do you want to put it? There it is.
That's it. That's it. Brave for the nurse.
You've got one.
You want the whale one? Did you want the whale one instead? All right, you can have 2 then, because you had 2 injections. Yeah?
What do you say?
There we go.
What do you say?
All right, good boy.
Right, can you sit down then?
All right then, bye-bye.
Thank you. So have a nice day.
You too, bye.
Come right in. good. So this is Aaron. What can I do for Aaron?
Poorly, bless him. Firstly, he keeps rubbing his ear.
A right or left ear, or do you know which one?
A bit of both. So
Okay.
I did think it was just because of teething.
Yeah.
But looking at it this morning, it looks very waxy at the same time.
And how long has he been rubbing his ear?
Oh, ages.
Okay.
And then his breathing's just atrocious at the minute.
Any family history of asthma or anything
Only
like that?
my brother, possibly his older brother.
You mean Aaron's older brother?
Yeah.
What age is he now?
He's 6 now.
Okay. Is he eating okay?
Less than usual,
Yeah.
but he is
He's
still
eating,
consuming,
yeah. And his bowels and his urine and so on, they're all okay?
Yep.
So just going to look in your ear, Aaron, now, just to see what we can see. That looks pretty good.
The other one.
Okay.
It's a bit gooey this morning.
Doesn't it look a bit gooey? Yes, it is a bit gooey, you're right. What's in there is debris, it's dead cells, and the body responds to infection by oozing.
Okay.
So it's that ooze, it's dead cells, it's some pus cells from the immune system to go and fight the infection. Now let's listen to his chest. He's obviously a good grubber. He eats well.
Yes. Which is quite unusual because at the minute he is being quite a fuss pot, but he does
You're
normally
being a
like
bit of a fuss pot. You a good boy?
He is generally a very good boy. Just
Yes.
last couple of nights have been extremely hard. I think we've had about 2-3 hours sleep per night.
Ah, right, yeah. And we just want to see his throat. So just one arm around his arms and one arm around his forehead. That's right, I know, but don't you worry about it. That's it. Yeah, yeah. So he has an infection in his chest and an infection in his throat and an infection in his ear. But he's also a bit heavy.
Am I feeding him too much?
I think so, yeah, I think so. It's not always easy for a doctor to raise the fact that a child is overweight with the parent because there's an implied criticism or the perception that the doctor is criticizing the parent when that isn't the case. The doctor has an obligation to draw to the parent's attention any problems that are being stored up for the future.
What can I do about his feed? Because even I know for a baby he does feed a lot. So he'll have breakfast milk, lunch, dessert milk, dinner, dessert milk.
Yeah. I think just begin to restrict the amount he takes of each food. So put out less for him and less feed. Maybe dilute the feed slightly so you have the same volume, but just less food in it. Just miss out a scoop.
Okay.
And then of the solids, just give him smaller portions and just gradually restrict it that way in a way that he won't notice.
Okay.
Yeah, because he just likes his food, and some of us do. And, It is okay to deny a baby food when they're taking or getting more than they need. There are times when you have to take that bottle away. There are times when it's better for the baby or the child to take that plate away. The body wasn't designed to use excessive calories in any sensible, healthy way. The ear drop, I want him to take 3 drops into the right ear for 10 days.
3 drops right in 10 days.
Yeah, it'll all be on the thing.
Thank you so
I'm sure
much.
you will.
Thanks a lot.
Bye-bye, Aaron.
Say bye.
Bye-bye.
Bye.
Bye-bye.
Brilliant. Thank you.
You're welcome. Nice to see you. Bye.
Hello, you gonna give us a smile? Oh, she just gave you a real look there, Emma. Give me 5. Give 5. Good girl. Another one? Yeah.
Let's book for 10 to 9.
Oh, you want another one before we go? Good girl.
Thank you so much. Thank you. Bye-bye.
How can I help?
You can see by it says his rash.
Yeah.
It's completely covered all over his body.
Mm-hmm.
He's been taking Piriton.
Mm-hmm.
But he keeps sticking it up. I don't think he likes it.
Is there any discomfort with it?
No, it's not eating.
No? Okay, so he's quite comfortable in himself?
Yeah, he seems all right, yeah. I'm just feeling itchy looking at him, that's all.
Completely.
Yeah.
And is there anything that he has that makes this worse?
It's only because he started crawling, whether he's getting around in carpet or something. I'm not sure.
So can you just undo his dungarees so we can have a look? Oh, I'm sorry. Okay. And you've not changed your washing powder or soap or anything like that recently? So, let's lift you up. Mum, can you just grab his back? Just have a look at that. Okay. Okay. Normally what we'd use is a mild steroid cream just to settle it down, but it's not really going to help us find out the cause of it. So considering he's so young, I think it'd be worth getting paediatricians to have a look at him to see what they think, to see if they want to carry out any sort of testing. Because he's been weaning onto solids. Is this a food-related allergy? Is it something else?
So just carry on taking the Piriton.
Carry on taking the Piriton, that's not going to do him any harm, and hopefully eventually it will start to take effect. Anything that you think's making it worse, obviously just try and avoid and keep a note of, okay?
She reckons it's me. I don't think he's allergic to me.
Well, I don't think it would take 6 months for it to show.
Yes, that's what I thought. Okay then.
Okay.
All right, thank you, Doctor.
All right, no problem. You
Thank you
take
so
care.
much.
Don't forget his tummy.
Oh, yeah.
Okay.
Is Mum at work today?
Mum's travelled.
So you're having daddy-son time together?
Oh, of course.
Yeah, when we get home, you can have a biscuit. So if you eat in the pot for Daddy, I'll give you what you want.
Is there anything else you want to say to the doctor?
Yeah.
Are you sure?
Yeah.
That's good. I like your smile.
Very pretty smile. You ready, Daddy? Okay. You okay?
Yeah, I'm fine.
Hello. Hello.
Hi.
So little one's here for her first injections. Okay, so it's 3 injections today. So it's this one, diphtheria, tetanus, pertussis, polio, all combined there. This one's for pneumonia, and then one for meningitis B. Okay. And then this one is medicine that goes in the mouth. Okay. So Mum didn't want to come in then, she's left you. Sometimes mums get a bit upset, don't they? Yeah, right there. Pull that out for you. Right, so if you just sit back over here and just hold her as you... Bring baby with you. Oh, bless. Just... Oh. Okay, so she will cry, okay? Oh, no, I'm sorry. Oh, no. That's it. Fine, give her a nice cuddle. She's fine.
No. You made me cry.
That's why Mum sent you in. It's not...
baby. What did they do to you? Did it make you feel bad?
Well,
You
it
get
used
used to it,
to,
I suppose,
yes, I'm
yeah.
sorry, but yeah, you've got to kind of think it's for their own good in the long run, isn't it? So, yeah, so, no, I don't feel bad anymore. Okay, so just carry, everything is normal, but just give us some regular Calpol, all right?
Okay.
All right, then, take care. Keep her nice and cool, that's a good idea. Okay, bye-bye.
Cian McLaughlin, please. Hello there. Come through. I've got a medical student with me today, if that's all right.
That's fine, yeah.
Good, good. Come in. Have a seat. Right. This is Cian.
Cian.
Now then, what can we do for Cian then?
Been sent here by the missus, really.
Uh-huh.
She just wants to get him checked up.
Okay.
He's been refusing food a little bit.
Right.
He eats all day.
He's a good eater normally, isn't
Yeah.
he? What about any diarrhea or anything?
I've got a picture if you want to see it. But
go on, let us have a look and see.
I don't want to gross you out, but you can't really gross a doctor out right now.
No.
Right. That's what we got.
Yeah. Okay, that's pretty mucky. Do you see that?
It's kind of like...
Can the student have a wee look and see?
It's kind of like rice pudding.
Yeah, that's pretty loose. When was the last time it was like that?
That was at about 9 o'clock this morning.
This morning. Okay, fine. Just going to stick this in his ear and check
no
your
bother.
temperature, young man. Yeah, can you hear it? Beep, 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 beep.
Oh, boy.
That's grand. 37.3. Not too high at all. Let's see. So the skin's good. I'll just feel under there. That's good. Ah, you don't want to. Can I have a feeling of his tummy then? Hello? What's this? Put that there. What's that? Wow. Good boy. Look, put it there. Right. Yeah. He's almost, his tummy's okay, a bit noisy, but not just what I would expect with a bit of diarrhea and sickness. If he gets a temperature, a little bit of calpol, plenty of fluids, a little and often. If you find that suddenly he's got blood or anything in his stool, come back and see us. Okay then, take care, nice to meet you.
Thank you.
What is it, above high five? Five? You do high five? Yeah. You're a rascal.
All right,
Okay.
thanks very much.
Take care.
Thanks very much. Have a good day.
All very much. You too, thank you.
Now we're all better.
Hi. Right, come and have a seat. My name's Julie. So, what's been happening to you then?
We were on vacation in Thailand. We were on the tourist island on a monkey beach, and this monkey suddenly jumped on me and bit me twice on my right arm.
Oh my word.
Somewhere around here where
Yeah, I
you
can
can't
see,
see it anymore,
yeah.
and here where it's already healed a bit.
It's a bit better now. Oh. And so because of that, you're going to have some rabies vaccinations.
Yeah.
Yeah, and you've had 2 already?
Yes.
So this is your 3rd one?
Had one in Thailand and the second one in Indonesia.
Okay. Up to 60,000 people die worldwide each year from rabies in the developing world, mostly in Asia and Africa. It's a really nasty infection that attacks the nervous system and the brain, and it is almost always fatal once the person starts to get symptoms. So you're obviously very brave if you're having all these injections, aren't you?
The injections do hurt quite a lot.
Do they?
Yeah.
You must be used to these by now, are you?
No. You don't get used to needles.
No, okay. All right, just sit nice and still. I'll make a book. That's it, you're doing really well. Lovely, well done. That's it. All right, good job. Are you too old for an I've been brave for the nurse sticker?
He's 10, so do you want a sticker? Are you too old for a sticker?
Yeah, so I've got these ones. They're a little bit older. There's a monkey on there. You maybe not want the monkey, as it was a monkey that bit you. No, we don't want the monkey.
I want the whale.
I'm going to have the whale. Lovely.
Thank you.
Okay, so that's mine. And, yes, and we'll see you in a week's time.
Okay.
All right, then. Okay, then. Bye-bye.
Bye.